Hi, okay. Great, thank you so much for the introduction, Abby. Sorry, I'm just here wondering if when I shared my screen, if I optimized the phone. So I'm just gonna stop and
sure. Get yourself, that's fine.
So bear with me, please, everyone. Okay. Yeah. Okay, great. So thank you for the introduction and thanks to everybody who has joined and who is joining. So today we're going to just kind of talk a little bit about the connections between sugar-sweetened beverages and the public health challenges that we have, that we're seeing and that we're really trying to combat through our health education campaign, You're Sweetened Up. So thank you for being here, and we'll just kind of dive right in. I wanted to start with just telling you a little bit about Lake Health and Wellbeing, who we are. So we are a public health NGO in St. Kitts and Nevis, and are registered as a nonprofit company, which means we are a registered business. However, the work that we do is not for commercial profit or gain. Work that we do is essentially for the public good, as we are a non-governmental organization, and we focus on doing our work to improve the health and well-being of our communities, which is essentially the mission of our NGO. So the work that we do, we decide to engage in projects, implement different campaigns, advocacy research that are all centered around and geared towards improving the health and well-being of our communities. So that may look different. We conduct different research studies, do advocacy for various policy development, implementation, health education campaigns, hosting events like this webinar, and we also collaborate with government departments and ministries, also with the private sector, and also with other civil society organizations and NGOs. So that's just a little bit about us and the work that we do. So just to kind of help people understand and contextualize the public health challenges in St. Kitts and Nevis, and essentially what our work is focused on pretty much improving and pretty much combating, is when it comes to non-communicable diseases, they are essentially the primary and most major health challenge in the Federation. Over 80% of deaths in St. Kitts and Nevis are actually due to a non-communicable disease. So when we talk about non-communicable diseases, we're talking about things like diabetes, hypertension, different forms of cancers, and those kinds of health conditions that we typically develop or contract not as a result of transmission from other people, but as a result of lifestyle, environmental factors, health, and those kinds of issues. And so when we look at some very common non-communicable diseases, so diabetes is very prevalent in St. Kitts and Nevis. The prevalence rate is 23%, and that's pretty high for a small federation like ours, especially since the worldwide average is actually 8%. So we have a very high rate of diabetes in St. Kitts and Nevis. We're actually ranked number 23 in the world, and there are like 198 countries in the world. So we have a very high prevalence, and we're actually second to Barbados in terms of Caribbean countries with the highest prevalence of diabetes. So this is a major concern for us to have such a high prevalence rate of diabetes. Similarly, hypertension. So we have a high rate of hypertension with a prevalence rate of 35%. And this is also very common and alarming for us as a small country with, a population of just 50,000 people. And when we come to also obesity prevalence, we also have very high obesity rates, which is a major risk factor for the development of other non-communicable diseases. So, as a result of overweight and obesity, we tend to find that's a risk factor for developing other non-communicable diseases like diabetes, hypertension, and other forms of cancers. And so our obesity prevalence is, typically you could say like 1 in 2 adults is considered either overweight or obese in St. Kitts and Nevis. And when it comes to our children, we're finding the rate of obesity increasing, where currently we see it at a rate of every 1 in 3 children is considered either overweight or obese. And so these are very high statistics, which are particularly alarming. And so we're really trying to be able to find interventions that help us to address and sort of curtail the rising trends that we're seeing when it comes to these public health conditions. So when we think about the reason for these challenges, we find that lifestyle factors are really contributing to the high rate of non-communicable diseases. And so physical inactivity is very common. Some recent information and data that we find is that 41% of adults were physically inactive, and this is based on a World Health Organization report. Similarly, 58.4% of children are also considered to be physically inactive, and we know that physical inactivity is a major contributor to the development of overweight and obesity, as well as poor diet. And so we have a combination of physical inactivity and poor diet where we're finding that people are not actually consuming fully nutritious meals. So for example, 97% of people said that they eat fewer than 5 portions of fruits and vegetables per day, which is concerning, since fruits and vegetables you should actually consume at least 5 portions of fruits and vegetables every day in order to meet your nutritious recommended values. Similarly, we find that the consumption of sugar-sweetened beverages is very high, and sugar-sweetened beverages have been found to be linked to the development of overweight and obesity, as well as development of diabetes and also dental issues. And so we found, this is from the Global School Health Survey, where 62% of school children actually reported drinking 1 or more sugar-sweetened beverage every day. And so we're seeing that these trends are not just unique to St. Kitts, but it's also a regional problem. So when we're talking about addressing these public health challenges, we really want to understand. So for example, one of the things that we want to consider is our SSD consumption. And so one of the things that we kind of want to highlight is what are the dangers of sweetened beverages. And so I'm going to play this short video for everybody so that you can kind of get a sense of what are the dangers of sweetened beverages and why we should be particularly concerned about them for now. So I'm going to play this.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank 1 or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, 1 serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
Okay. Great. So within that clip, we kind of were able to understand and highlight how the impact of sugary drinks are actually bad for our health. And that's kind of what brought us here at Lake Health and Wellbeing to develop the campaign that we currently have. So we have the Your Sweet Enough campaign, which is a health education campaign that we've designed with the intention of informing and educating the public about the dangers of sugary drinks and trying to mobilize everybody to drink water as the healthy alternative. And so the purpose and objective of our campaign is essentially to raise consciousness around just the negative health effects of drinking sugary drinks and the impact it has on our health and well-being, And so we have a number of campaign material, but much of the campaign messaging is kind of captured in our campaign jingle, which is actually sang by a local artist, well-known, Du Jour. And so I'm going to play the jingle for you because it has all of the messages that we're really trying to convey with this campaign to help educate people and get people to change behavior and understand and make better and healthier choices. So this is our jingle for the You Are Sweet Enough campaign. Hopefully some people have heard it already and you'll enjoy it.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science, sugar, low and fat. But don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
Okay, so I really hope you guys enjoyed that little jingle. It's actually one of my faves. So with the jingle, like I said, it captures a lot of the central messaging that we have. So what we're really trying to get people to do is really just kind of take a minute and understand, you know, when you're choosing to consume sugary drinks, so that sodas or juices or iced teas or anything like that, we really kind of trying to encourage you, you know, to consider how much sugar is in the drink. So when you make these choices, take a pause, you know, stop and think about how much sugar is actually in this drink. And, you know, I typically, when you think about how you want to know how much sugar is in this drink, we're trying to get people to really think about and read more labels. So, you know, take a minute, stop and read soda labels, because that's where you find out just how much sugar is in some of these beverages that we're consuming. And it would probably alarm you just how much sugar is actually in a standard size bottle of soda. So on the screen, I have an example of a soda label. So a soda label of a bottle that's about this size. So this is just a regular standard soda bottle. This is the label that is. This is the bottle that is attached to this label. So I kind of want to go through this like nutrition label so that people can really understand how much sugar they're actually consuming by drinking a standard bottle of soda like this. So on the third line, we see that it says serving per bottle is 2.5. So there are 2.5 servings in this one bottle, right? And down the list, where it says sugars, you see where it says sugars, it says 33 grams of sugar. Now this is per serving. Note that we see it says amount per serving, and in the list it says sugars 33 grams. So 33 grams, that's just one serving, but note there's 2.5 servings. So 33 times 2.5 is actually 81 grams of sugar. Now that actually translates, equates to 21 teaspoons of sugar. So 4 grams of sugar equals 1 teaspoon. That's the calculation. And so in this one bottle of soda, there's actually 21 teaspoons of sugar, and this is what 21 teaspoons of sugar looks like. So just in case you didn't have like a conception of what 21 teaspoons of sugar looks like, this is what you're consuming when you drink one bottle of soda. And we know that, you know, people typically drink one of these bottles for lunch. Some people might have a bottle of soda for breakfast, taking them into their lunch, and then one in the evening while they're eating dinner or whatever they're having in the evening. And so when we really think about that, this is how much sugar we're consuming. And the truth is, in fact, is when you're drinking these drinks, there is no other nutrient value. So you're not consuming anything else that is nutritious. And so that's why it's particularly alarming, and why we're trying to encourage people to eliminate the consumption and reduce the consumption of sugary drinks, because it's really bad for our health, because it exceeds the amount of sugar that we should be consuming in a day. And one thing to remember too, is that you also consume sugar in the foods that you eat. So when we think about that, so it's not just limited to sodas when we're thinking about just high sugar consumption, because some people might say, oh, but I don't drink sodas, I drink, you know, juices. And this is kind of a misconception, which is why we're really trying to impress upon people, regardless of what the drink is, be conscious and try to take a look at reading the label and understand how much sugar we're consuming. So, I have this image here of like, I want people to kind of drop in the chat, have a guess, take a guess about just how much sugar do you think is in this bottle of apple juice? Now, this is 100% juice. So of course, it's not made from any added ingredients, but, if you can right now, take a guess. You can drop just a number in the chat. But how much sugar do you think is in this bottle of apple juice? So I'm gonna give like people a couple seconds if you choose to respond. But we'll find out right now. So this is a small video and animation. This is part of the materials that we have been producing as part of the campaign to kind of educate people and let people know just how much sugar they're consuming from typical beverages. So this is a Welch's. Let's see.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say it's sugar low in fat, but don't be fooled by that.
The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily.
Drink some water, share some love. Tell your body you're sweet enough. Drink some water.
Okay, so if we could recall, so I'm just gonna go back here. So remember, this drink actually had 53 grams of sugar. So when we think about how much sugar we should be consuming, which is the recommended amount, so children should be consuming less than 25 grams of sugar, and adults should be less than 50 grams. So that bottle of apple juice was actually 53 grams, which far exceeds the actual daily recommended amount that both adults and children should consume. So, regardless of whether you think, 100% juice is better than a bottle of soda, really the point that we're trying to impress is that it's the sugar content. Because some of these juices, a lot of these juices that are natural juices and say, 100% juice are also very high when it comes to sugar content. And so I just kind of want everybody to remember just, how much we should be consuming on a daily basis. Remember, children, it's less than 25 grams, which is 6 teaspoons of sugar. And for adults, it's less than 50 grams, which is 12 teaspoons of sugar. And that's daily. And remember, again, we consume sugar also in the foods that we eat, not just in the drinks that we drink. So if you're drinking one juice and it already far exceeds how much sugar you should be consuming, just imagine just how much sugar your body has to process if you're consuming multiple bottles of juices and still consuming your regular meals. And so that's why we find that we're really trying to tackle reducing SSB consumption and encouraging people to drink water, because that is the healthy alternative, and water is extremely important for our health and well-being. So this is just another example. I just kind of I know Coca-Cola is a very popular beverage for lots of people. I've had friends who talked to me and told me as well that they Coke is one of those addictive drinks. So I kind of want, again, this one is another just kind of guessing game. Just kind of, can anybody guess just how much sugar you might think is in a bottle of Coca-Cola? I know that's a popular beverage for folks. So encouraging people to drop their guess in the chat, in the Q&A. You never know, you might just win something depending on how close you are. But Coca-Cola, again, this is one of those addictive sugar-sweetened beverages, and we're really trying to get people to understand just how much sugar is in it. So ready for the answer. So there's 63 grams in a standard bottle of Coca-Cola. So again, if you remember, this is exceeding the recommended daily amount of sugar that we should be consuming, whether you're an adult and a child. And so, imagine, I know there are some people who drink multiple bottles of Coca-Cola a day. And, because of the fact that sugar itself is quite an addictive substance, we don't realize just how negatively it affects our bodies and contributes to the development of things like diabetes, to the development of overweight and obesity. And so we really kind of want to impress upon people, remember, this is about how much sugar, think about this. If you were given this to consume, would you? This is just about how much is in one standard bottle of soda, like a Coca-Cola. So just be a lot more conscious, that we are consuming way too much sugar from consuming these sugary drinks, and it's really bad for our health. So really encouraging people to understand whatever your beverage of choice, just be a lot more conscious about reading the label to find out how much sugar is in that drink, and really choose water instead, because your body benefits and your health benefits a lot more from drinking water instead of a sweetened beverage. So that's the kind of messaging, think before you drink, because remember, the consumption of sugary drinks is connected. We have found, studies have shown that it is connected to the development of obesity, heart disease, high blood pressure, diabetes, and other forms of cancer. So really encouraging people to remember that you're sweet enough and think before you drink. Think before you consume all of this sugar just from drinking one bottle of soda. So I really wanted to kind of leave people with this is another one of the animations that we have, because we know that sugary drinks can be quite addictive, but this is kind of a humorous way that we're also trying to convey the messaging around how sugary drinks can be bad for your health, and how, choosing water instead can actually help to make you feel better, look better, and just kind of overall improve your health and well-being. So I'm going to play this one for everybody.
Hey, man, I just can't believe that.
Yo, sweet boy, what you really crying for?
Why you see me crying, boy? My man crying. I just see her thinking about that girl. I think she cheating on me,
You lie.
Boy, for real. A couple of weeks ago, right? She come telling me how I'm too sweet. And that I just make she belly roll, and I got her thighs rubbing. What is that?
No, man.
But yes. Look, she tell me, right, that we need some time apart. To be honest, I wasn't too concerned about that, because you know how the girls and them, they're addicted to me sweetness. But then I see she the other day, and the girl looking so good, looking so fresh and so lean.
Boy, you sure she addicted to you?
But yes. But wait. Look at here. Come. Hide. Boy, come hide now. Oh, I can't believe, but is that what going on? Really? Why you got to say for yourself?
Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
Okay, great. So I really hope that we kind of were able to, hope you enjoyed that. That's, this is one of our most popular videos, that one of our most popular animations that we have. But, essentially the messaging is the same. When we heard Sweet Boy talking to the water, and he was saying, recognize the change in his girl who's been drinking him for so long. And, the water kind of saying, well, since he started drinking the water, he's been looking all lean and nice and looking good. So, that's also kind of giving the message in a much more humorous way, where we see that drinking sweet beverages may not be the best choice, best for our health. And so really encouraging people to drink water and share some love and show your body and tell everybody that, you're sweet enough. And that's really kind of what we want you to take away. Make sure you kind of remember that sugary drinks, the high consumption, the high sugar content that we find in, a lot of these sweetened beverages, regardless of whether it's soda or regardless of whether it says 100% juice, the sugar content is really what we should be paying attention to. And in order to really understand and know what that is, we encourage you to read labels, and also just ultimately, even if you choose to just purely drink water, that's really the best choice. Remember that you're sweet enough. And just encouraging you to
share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
So that's essentially the end of the presentation today. Kind of kept it short and sweet and light, during this kind of lunch and learn. So really here, ready to invite questions from anybody or comments. I don't know if there were any in the chat, in the Q&A. So I'm open to hearing.
Wonderful, wonderful, wonderful. Thank you, Isley. So there was one question. So the question is, what measures do you use to consider an adult overweight or obese? Do you use the BMI? Because as I understand it, it was not created for the persons of Black descent. I could answer.
Okay.
Yeah, but you go.
Sure. I mean, okay, sure. So I would say from what I understand, we as in Lake Health and Wellbeing don't have a specific measure, but the standard measure is using the BMI to determine what overweight and obesity is. And so that is the measure that is typically used, I guess, when the Ministry of Health or when health medical practitioners are determining rates of obesity or whether a person is overweight or obese. I do understand and know, and I'm conscious of the biases that come from these indexes that have been created. But at least for now, in terms of the medical community and medical standards, the BMI is what is used standard across the board, from what I understand. I don't know if Abby had anything else to add.
Yeah. So definitely the BMI is not perfect. And I think it's recognized that the BMI is not a perfect measure of people overweight and obesity, but it is the most useful measure at the moment. We know that it might not necessarily represent BMI accurately in some ethnicities, but then also people maybe that are athletes who have a lot of muscle mass and those kind of things. But it is the best measure at the moment. I know in the UK, they had started to try and develop a different scale and they were testing it out for people of African descent, so for Black people. And I know that there is one university that has a calculator where you can put in your ethnicity so that it then works out your BMI based on your ethnicity as well. So yes, so there are issues with it, but it is generally the best option that we have right now at the moment. So I hope that answers your question.
Right. And just to add to that, throughout, recognizing, that there are different contributing factors to the development of overweight and obesity, we kind of also just really want to make sure that people understand that, you can be a slim person, but also be unhealthy. And so, we gather, there are people who, may not appear to be overweight or obese, but are still drinking and being unhealthy in terms of their beverage choice. And so regardless of that as well, we really still want people to be conscious of the messaging and to kind of take it in, because really the consumption, at the foundational level, consuming these sweetened beverages is bad for your health, regardless of whether you are considered overweight or you're not. But if this is part of your diet, we're really trying to shift culture in that regard and really get people to drink water and just become healthier for whatever that looks like and whatever that is for you.
Yeah, good point. Really good point. So does anybody else have any questions or comments that they would like to put to us? No, it doesn't look like. No more questions, okay. No more comments. Okie dokie. Well, so that's it then. So I'm just going to let me just quickly share my screen real quick. I'm just going to. Okay. All right, so just to say that we're doing these lockdown lunch and learns. We've got 2 more coming up. So on Monday, we're going to be exploring fibroids. So fibroids is a women's health issue. And last year, we conducted some research to explore the impact of fibroids in women living in St. Kitts and Nevis. So if you have an interest in women's health, feel free to join us on Monday. I'm going to be talking about what fibroids are, but I'm also going to be talking a little bit about the experience of women in St. Kitts and Nevis, what the challenges women have, and what we can do to improve women's health and well-being in terms of fibroids. Then on Tuesday, we're going to hear about our new research project where we're looking at COVID-19 and the impact of COVID-19 on people with NCDs and how you can get involved in that project. So feel free, you can register for that as well. And then after Tuesday, we're hoping to have a couple more sessions that might not be health related, but should be interesting all the same. So feel free to attend the next 2 sessions. We'd love to see you there. And if there are no more questions, then we're going to end this lunch and learn session. Thank you so much for your attention and your time. And we hope you found it informative. So keep healthy, drink some water and share some love.
Share some love, right. Don't forget, you're sweet enough. So thanks everybody for your time and your interest. We appreciate you attending.
Yeah, so thank you so much. So take care. So I'm going to end unless you have any questions, no questions. So we're going to end in 5, 4, 3, 2, 1. Bye, everybody.
Bye, everybody.